All right. Hello and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Kim To, Assistant Professor of Digestive Disease at Yale University and an Associate Editor of the Social Media section with CLD. I am joined by Dr. Fuchs from the Division of Hepatology at Yale University to discuss his article, Natural History of Prognosis of Pediatric PSC with Updates on Management. Thank you for joining us.
Thanks so much. Appreciate the time. And I'd like to thank the journal as well as my co-author and colleague, Dr. Pamela Valentino, for helping put all this together.
Great. How is the diagnosis of PSC made? And when should a clinician suspect this disease in children and young adults?
PSC, or primary sclerosing cholangitis, is usually confirmed via cholangiography, be it MRCP or ERCP. It's easy to see bile duct irregularities such as narrowing as well as varying degrees of dilatation. These are, again, identifiable on cross-sectional imaging. But now ERCP is not necessarily recommended as the initial test, especially in kids, because we don't often find these dominant strictures that would require intervention. More often in the diagnosis of children, they present with inflammatory bowel disease and persistent elevations in GGT, and that's when PSC should be suspected. And children may not have the typical findings on cholangiography, as they are likely to have small duct PSC, and in that context, the liver biopsy would be informative.
Since a lot of these patients aren't really symptomatic, how can you evaluate for disease progression in this population?
Yeah, staging for PSC is pretty challenging. Evaluation for disease progression should be performed with every clinical encounter. Normalization of GGT within a year of the diagnosis has been associated with better event-free survival at 5 years, regardless of therapy. Elastography is a valuable and non-invasive alternative to biopsies when it comes times to estimating the progression of fibrosis. But I'd also encourage clinicians to use the SCOPE index, the Sclerosing Cholangitis Outcomes in Pediatrics Index, which was developed by the Pediatric PSC Consortium as a way to address risk stratification. It's a validated tool. It uses simple blood tests like bilirubin, albumin, platelet count, and GGT, as well as the MRCP or ERCP findings. And this helps estimate the risk of liver transplant or death at 1 year and 5 years from diagnosis.
Wow. And you know, for our adult patients, we find it challenging to find treatment options. What treatment options are available for our pediatric patients with PSC?
Right. Well, unfortunately, medications that impact the natural history of PSC are still being sought. Ursodeoxycholic acid is often used in pediatric practice, but while it might improve liver biochemistry, it's not been shown to have an impact on the progression of disease. And oral vancomycin has been reported to be beneficial in a small number of children with PSC IBD with C. diff-associated diarrhea. In those cases, liver transaminase is normalized when they received vanco, but it increased after discontinuation and normalized again when it was resumed. So there might be something there, but an analysis with retrospective data from the Pediatric PSC Consortium found that neither oral vanco nor ursodeoxycholic acid resulted in improved outcomes when it came to treated versus untreated patient comparisons. So really, liver transplantation is the only effective treatment once a patient is decompensated from end-stage liver disease.
Well, that's very interesting. And, thank you again for joining us for, on this another installment of Clinical Liver Disease video series. And we'd like to thank our readers for joining us. On behalf of all of us on the CLD team, I hope you found this interview as interesting and inspiring as I have. For more information about the article, please visit us at www.cldlearning.com. Also, don't forget to follow us on Twitter at cldlearning. And Dr. Fuchs, thank you for sharing your insights on PSC in our pediatric patient population. This is a disease that continues to challenge our clinicians, and these updates are very helpful, especially in terms of getting an early diagnosis and determining prognosis. We appreciate your time and all your efforts.
Thanks so much. My pleasure. Encourage your audience to read the full article in Clinical Liver Disease. Thanks.